Hello, Inasal. I am Dr. Mohammad Fakhrul Chowdhury. I am presenting my abstract now. Title is Effect of Roxadustat in Management of Anemia and Iron Regulation in Cirrhosis of Liver Patient. Anemia may be seen in 66 to 75% of patients with liver cirrhosis. Anemia is associated with a significant risk for decompensation or mortality during the long-term follow-up. Anemia negatively affects hyperdynamic circulation in patients with RD cirrhosis. Correction of anemia is an important part in management of liver cirrhosis patients. Anemia in cirrhosis is often multifactorial. Iron deficiency anemia is common. However, the most common cause of anemia in cirrhosis is anemia of chronic disease. Roxadustat is an orally administered drug that prevents the enzymatic degradation of hypoxia-inducible factor by inhibiting the prolyl hydroxylase domain enzymes. Thus, roxadustat inhibits PSD enzyme and HIF is stabilized. HIF proteins stimulate the erythropoietin gene in kidney parenchymal cells to produce erythropoietin, as well as other genes, including the iron transporter ferroportin. Erythropoietin activates red blood cell production in bone marrow, and ferroportin facilitates iron absorption in a small intestine. Roxadustat currently is being used in anemic CKD patient. Roxadustat is safe to be used in Child-Pug A and Child-Pug B liver cirrhosis patient and may play a vital role in the management of anemia. This study is to see the impact of roxadustat in management of anemia in liver cirrhosis patients. This is one of the earliest trials of roxadustat in the world for management of anemia in cirrhosis of liver patients. In this picture, in above picture, we can see how in presence of oxygen, HIF alpha by proline hydroxylase enzyme is hydroxylized, then by the volhypolpindutropin it is undergone in proteasomal degradation. But if we use roxadustat, which is a proline hydroxylase inhibitor, it inhibits proline hydroxylase domain, so HIF alpha is no longer hydroxylized and it can be degraded, so it does its action on its target site. It has two effects: on reversible effect on erythropoietin, and it has irreversible effect on hemoglobin, so its effect of hemoglobin persists up to the lifespan of RBC. Hypothesis: roxadustat increases hemoglobin level and decreases serum hepcidin level in cirrhosis of liver patients with anemia in comparison to a standard medical treatment. General objective: to evaluate the effect of roxadustat in increasing hemoglobin level and in iron regulation through decreasing hepcidin level with anemia in liver cirrhosis patients. Specific objectives: to measure hemoglobin level, iron profile, serum hepcidin level, erythropoietin level in liver cirrhosis patients with anemia. To measure these parameters after roxadustat treatment for 6 weeks in liver cirrhosis patient with anemia. To measure these parameters after a standard medical treatment for 6 weeks in liver cirrhosis patient with anemia. To compare these changes of parameters between roxadustat group and a standard medical treatment group. Outcome: primary outcome, increase in hemoglobin level in roxadustat group than a standard care group. Secondary outcome, change in hepcidin level and erythropoietin level in roxadustat group. Selection of patient. Inclusion criteria: patient with cirrhosis of liver, Child-Pug A or B with anemia, age 18 to 65 years. Exclusion criteria: patient with Child-Pug C liver cirrhosis, HCC, hemoglobin level less than 7, pregnancy or lactation, active variceal bleeding, adult polycystic kidney disease, hyperthyroidism, systemic hypertension, hyperkalemia, patient with comorbid condition, and anemia caused by other hematological disorder. This is a randomized control trial. Sample technique is simple random sampling, and our sample size determination came 28 participants in each group. We took 30 patients in control group and 60 patients in treatment group. Patient in Bangabandhu Sheikh Mujib Medical University were initially evaluated who fulfilled all criteria, inclusion criteria and no exclusion criteria, was enrolled in this study. and complete blood count, liver function test, serum albumin, prothrombin time, alpha fetoprotein, thyroid stimulating hormone, iron profile, serum creatinine, serum electrolytes, ultrasonography, ECG, endoscopy were done. Every 3 selected participants were enrolled into one block. Simple randomization was done in each block by lottery method to group 2 participants in roxadustat treatment group, that is group A, and 1 patient in standard medical care group, group B. Total 30 blocks were created by simple randomization in each group. Total 60 participants were enrolled in group A and 30 patients were in group B. Serum hepcidin level, erythropoietin level, lipid profile, reticulocyte count were also done. Both groups were followed up after week 3 and week 6 after starting treatment. 50 mg roxadustat was given orally thrice weekly for 6 weeks in group A patient. Group B patient received standard medical therapy. CBC, reticulocyte counts, hepcidin level, iron profile, erythropoietin level were done after 3 and 6 weeks. Liver function test, lipid profile, creatinine, electrolyte, TSH were also done after 6 weeks of treatment. All the analyses using statistical package SPSS version 27, chi-square test was used for computing qualitative variables, paired t-test for quantitative variables. In our result, we can see the types of anemia: 68% normocytic normochromic, followed by 23% microcytic hypochromic, then 7.8% macrocytic anemia. The most common cause was hepatitis B virus, 57.7%. These were the laboratory parameters between treatment group and control group and baseline. In treatment group, we can see hemoglobin is increased from 9.78 to 11.04, which is statistically significant. Also, statistically significant change was seen in MCV, in LDL, in ferritin, which was reduced, in erythropoietin, which is increased, hepcidin level decreased, and also in albumin Child-Pugh score. Ferritin is decreased, iron is slightly increased, TIBC is increased, but TSAT is slightly decreased. Change of hemoglobin observed in all types like microcytic, normocytic, and macrocytic anemia. This is the comparison of changes between treatment group and control group. We can see hemoglobin changes is statistically significant. Also statistically significant change is seen in ferritin level, in erythropoietin level, in hepcidin level, in albumin, and reticulocyte count. Hemoglobin increase in 90% patient, hemoglobin increase in 24% patient in control group. In treatment group, erythropoietin increase in 68% of patient, and in control group only in 28%. And hepcidin decrease in 78% patient in treatment group, and in control group 24% of patient. Hemoglobin increase in group A and decrease in group B. Hepcidin decrease in group B, increase in group B. Erythropoietin increase in group A and decrease in group B. Significant coefficient are observed for hepcidin changes. For increase in hepcidin, there is decrease in hemoglobin, and if hepcidin decrease, there is increase of hemoglobin. Nausea, headache, loose motion, pain, but there is no statistically significant change between two groups. In roxadustat treatment group, hemoglobin level increase and hepcidin level decrease after 6 weeks, and this change were statistically significant where compared with the change of standard medical care group. The limitation: single center study, sample small size, and long-term follow-up was not done. Need large multi-center study, long-term follow-up of the patient. Thank you.